I'm Ward Blackwell. Welcome to Front Street 411. Over the course of the pandemic, it's hardly been uncommon for there to be some disconnect or inconsistencies between government messages to the public and those to healthcare providers. The latest example of this arose with the CDC's May 13th guidance that people fully vaccinated against COVID-19 no longer need to wear a mask or socially distance in most situations. When the Department of Health confirmed that Pennsylvania would follow the new CDC guidelines, well, quite a few of you wondered what that means for your dental offices. The DOH order adopting the CDC guidance specifically states that it only applies in non-healthcare settings. As we indicated in a member update on May 14th, none of this changes anything for dental practices. The DOH dental guidance of June 3rd, 2020 remains in effect. Now, that DOH document does link to several CDC guidelines that in turn have received updates since last summer. But as of May 20th, none of those CDC guidelines that are linked to the DOH guidance have changed since February. So, PDA has been meeting with our partners in the Pennsylvania Dental Health and Education Coalition and communicating with DOH to offer our assistance with developing new dental guidance that hopefully might resolve some of the apparent discrepancies between restrictions in healthcare settings and those everywhere else. In addition, the ADA distributed a new set of COVID-19 FAQs that address at least a few of those discrepancies. We forwarded those FAQs to you back on May 17th, and we'll let you know just as soon as we learn anything else new. Now, for something that's not exactly new, but perhaps warrants some elaboration, as you may know, the requirement to opt in or out of Medicare in order for your patients to use their Part D prescription benefit was rescinded more than 3 years ago. However, you may not know that if you choose to opt out of Medicare, then neither you nor your patients are able to be reimbursed under Medicare Part C, which includes Medicare Advantage plans. Advantage plans are offered through private health insurance companies, including some of the same ones that offer those dental benefit plans with which you're probably pretty familiar. They also often include benefits like dental that aren't covered by traditional Medicare. So you probably should verify that you don't actually participate with any of those Advantage plans prior to choosing to opt out of Medicare. Also, if you did opt out on or after June 16, 2015, you have an opportunity to cancel your opt-out every 2 years by providing advance notice before it auto-renews. Similarly, when you opt out of Medicare for the first time, you have a short window in which to change your mind before you're stuck with your choice for at least 2 years. Finding out your status and or terminating it can be done online at cms.gov. Now, speaking of online, we all certainly know a lot more about what is available online since the pandemic started. No doubt, some of you have enjoyed the convenience of the online dental CE that proliferated while we've had so many restrictions on gatherings. So for you, PDA will not only continue to offer online self-study courses, we're adding 3 new ones this summer. Now that said, we are going to have some CE courses in person starting this fall. Registration information is in the graphic. Now, you can be assured that PDA will comply fully with whatever CDC and DOH guidelines are in effect at the time so as to keep everyone safe when we all get together again. And we may even go just a bit further to ensure the comfort of those who may still be hesitant then about attending a seminar. But we also want to accommodate the preferences of as many PDA members as possible. And we know there are many of you who are quite eager to get together with your colleagues again and enjoy the immediacy and interactivity of in-person learning. You're probably the same folks who'll be celebrating in maskless freedom when the governor's order lifting most remaining pandemic restrictions takes effect on the holiday next week. And I'd like to end on this invitation for all of you to take a moment that day to acknowledge that the purpose of the holiday is to remind us why we have that freedom. Have a great Memorial Day.